Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Chronic mercury poisoning. Chronic mercury poisoning is also called as hydrargyrism. Chronic mercury poisoning is characterized by classical triad of gingivostomatitis, mercurial tremors, and mercurial erythism. The tremors are also called as Danbury tremors, which typically starts with the fingers of the hands and then to the lips and tongues and finally to the arms and legs. The patient also presents with glass blower shakes, which are the advanced form of tremors. Final stage of tremors is called as concussio mercurialis, where in concussio mercurialis no work is possible. Mercurial erythism. Mercurial erythism is a neuropsychiatric condition where person is always depressed, anxious and shy. It is associated with delusions and hallucinations. Person is also called as Mad Hatter.
thank you and thank you for watching.